everybody, and welcome back to Boston Making a Difference and our feature program, BMAD Spotlight. Today we are truly highlighting some folks that are making impact and a difference in our community. We're talking to God's angels here on earth, nurses. So we're going to start off by first talking to Sheila Wilson, who runs an organization called Stop Healthcare Violence. So Sheila, welcome to the program with your friends Amy and Beckett. It's great to see you here, and thank you all for the work you do in our healthcare and in our pandemic times. I truly thank you, and I'm sure a lot of our audience out there thanks you as well. So, Sheila, welcome.
Thank you, Michael. Thank you.
Yes.
I'd like to start off with just a touch of history with Stop Healthcare Violence. And we started back in 2008. A bunch of us nurses working in the emergency room realized how many assaults we were getting. And it was terrible. You know, one day there might only be one assault, maybe a slap, maybe a pinch, maybe a kick. But we kind of all accepted that. It was like part of the job. Well, the one thing is, it is not part of the job. So in 2009, I became president of Stop Healthcare Violence. Our goals were simple, and they're still the same, is to have healthcare workers become change agents in their own facilities, to be able to stand up and say something. Now, I'm sure we all know that a lot of us don't want to stand up and say anything because we don't know what the ramifications would be. But it's time to do that. We also want to provide support and advocacy for the victims. Now, a victim to get slapped is a little bit different than a victim that gets pushed down into the ground and pummeled. It's still stress all over. The emotional component of being hit, slapped, kicked, or whatever is still there. So no matter how little the assault could be, it doesn't make any difference. She still needs, or he needs, support and advocacy. We also want to provide the public on the alarming epidemic of violence committed against healthcare personnel. And we also want to educate and inform the public as to what is going on, because the public truly doesn't understand. Most of us as nurses never came home and told our families, because a lot of these people that assault us will say, I'm going to kill you and I'm going to kill your family. Well, you're not going to be telling your family that. You just hide everything inside. Surveys that were done by M&A, which is the Massachusetts Nursing Association, and the Emergency Nursing Association, have surveys that show that 70 to 80% of your healthcare workers get assaulted. Now that's an awful lot of nurses, medical assistants, and everything else getting assaulted by who? Well, we get assaulted by our patients. And then if they have their family with them, the family may actually assault us. And if the family's not there, their friends are there. And they feel the need to assault us too, just to get our attention. We need to stop the violence. And we need to stop the violence by not accepting it as part of the job. We need to document every single incident, whether it's somebody that is simply having a seizure and assaults us, but we need to protect ourselves. We're not going to bring them to court or anything, but we need to make sure that it's all documented and that the hospitals understand that this is what's happening. What I'd like Boston Making a Difference to know is about the pandemic right now. I've talked about the violence and the assaults, but today Amy and Beckett are frontline people, and they can talk about the assaults from the institutions, the assaults of the masks, the lack of personal protective equipment. And I would like to make sure that these girls have the time to tell the public and to tell all of us, what is the update on this? Are you all now having all the equipment you need? Are all the chemical masks that you've been wearing gone? Are you documenting that you are not consenting to this, but you're doing it? This is only what's happening right now, Michael. And right now, I'd like to introduce Amy Smith.
Hello.
And Beckett Argott. Hello.
Welcome. Welcome to the program, ladies. Thank you for the work you do. And Sheila did a beautiful job explaining the issue with the violence. Now, why don't you tell us a little bit about, what you're dealing with on the front lines of this pandemic?
My name is Amy Smith. I'm an emergency room nurse. I work at the Brockton Hospital, which is a hotspot during this COVID pandemic. In the emergency room, we can have assaults from patients. We've been limiting the assaults from the family members and the visitors, as right now we're not allowing that to happen, right? They're not going into the hospital. But uniquely now for us, we're finding there's a lateral violence that is happening from management down. And it's not management like your direct managers or supervisors. It's really starting at a CEO level down with equipment. And it's assault on us personally as healthcare workers. And the assailant is a virus that we need protection from, and our hospital is not giving us what we need to protect ourselves from that. Similar to when we ask for security presence or police presence to protect us, at least in the emergency room, from patients and family members, we are asking management to provide us with the protection from an unknown and with the max protection, because it is such an unknown. And we're being given masks that are here's a mask for a week. The N95s that are coveted and spoken about, you get one. It then gets cleaned in some fashion. My work is sending some out to be chemically sterilized again, or they're just UV lighting them with your name on it at our hospital. 2 processes on a mask that manufacturer guidelines said you should put it on, take it off, and throw it away, 1 patient use, or at the very maximum, can wear it for 4 hours, continuous use, because you're not taking it off and on. It's then contaminated and no good, not because of what soils the outside of it, but because of the moisture and the degradation that happens on the inside of it. We're now asked to save it for the week, have it UV lighted, which is not a guarantee of anything. They're just hoping, because that's what they're using to clean the rooms, it's going to kill the virus, and give it back to you to wear again, hoping the seal is going to protect you going forward. It's a different world of assault that we're feeling at our hospital. But I think that's pretty across the board in all the hospitals.
So how can we help you, Amy? What are something that we can do, as citizens and, the public? What can we do to help?
I think it's really bringing forth, the hospitals are going forward with this reopening plans as we see numbers go down. So grateful numbers are going down. So grateful less people are being so affected by this virus that they're requiring ICU level of care. However, the protection for the frontline nurses is still necessary. We need clean, new equipment. In order for their reopening plans to happen, they have to have 2 weeks of stockpile. If the hospitals are allowed to reopen and they've got this 2 week of stockpile, why am I wearing the same mask for a week? What are you stockpiling against? Because you're not protecting me, the violence to me, and the protection of me bringing it home to my family. I've moved out of my house. I started working in the surge unit where I knew I would have dedicated protection, because those units, my hospital was very good at making sure we had what we needed there. But I also knew I was taking directly care of those patients with the illness of the worst kind. So I didn't want to bring that home to my family. I've now gone back to the emergency room where I still have equipment, but it's on and off, and it's the same mask that they want me to take on and off my face. So I'm actually at a higher risk for my family. I haven't moved home. So I need the community just to realize what's going on behind the scenes as the hospitals are out there saying, we're ready, we're here, we want to take care of you. We do, but we want to do it safely for you and for us.
Okay, well, that's an important point, so we as a public have to put pressure on officials to make sure that you're being protected. So now, Beckett, what can you tell us, from your point of view, what's going on?
So I work in an emergency room at St. Vincent's. It's in downtown Worcester, another hotspot. And we were running, 3 shifts, 3 12-hour shifts with the same mask still. They gave us a Tupperware container with holes to put it in to store it. We have now we have a mask a shift, but it's still, again, for 12 hours in and out of all different PUI, with people, person under investigation. So people that we suspect have the COVID virus. And we're in and out of those rooms with that same mask. You'll wear that same mask for the 12-hour shift, except for to eat or drink, and that's minimal because you're running. And the violence hasn't stopped. Unfortunately, Sheila and I haven't really talked, but my very last shift, I was assaulted, and now I've had to have blood work done. And, it's still going on. We still have all the psychiatric patients, all of that coming in. But on top of that, these hospitals are furloughing nurses, techs, security officers. I don't understand why we're furloughing security in the middle of a pandemic when people's emotions are high. I mean, we've had people threaten to run our tent over because the mother couldn't come in with her, with her child, but her child was an adult. And that's the tent where we're treating patients for COVID prior to them coming in. If it's somebody that we can treat and we can then send back home, that's what we're doing. But they've threatened to run those over. So now we have barricades in front of them. So that violence hasn't stopped either. And I think the escalation of people being isolated, the emotions, the anxiety is common. It's building up. It's getting ready to erupt. And unfortunately, we're the only people that they have contact with finally after being at home. And now they're sick, and now they're frustrated. And now they can't go in with their family members. And we're the ones telling them, no, you can't come in. I'm sorry. We're the ones they lash out at. And for the most part, I'll say that the public's been very respectful. There's been a lot of show of support. But yeah, PPE is a big problem. Our personal protective equipment's a big problem. We had to wear the same cheap plastic, which are one-use gowns, over and over during a shift and wipe ourselves down with bleach. We just got, last week, actually, Ford sent us gowns that they made out of airbags. And these are bigger, better, which is great because, the blue gowns weren't even fitting half the men that work in my department with us. These actually fit, but again, we're wiping them down and reusing them through a shift. So you don't know who's possibly infected, who's not. And we're going room to room, hoping that we got all of the virus during our wipe down.
Now, is this a problem with budget? They don't have the equipment, or is it a matter of supply? It's not there.
I think there's a combination, but I think it's a combination of both. But they also want to save money. They've been with the furloughs, even they didn't have to do them. They were given government assistance, and yet we're still turning staff away and not supplying helping hands or placing staff in areas that could have used it. I'm part of the union at the facility I work at, and we've fought very hard. We've sent people and sent nurses who've shown up, and they've checked in with different units, different COVID units in the ICUs. They've been given money by the government. What we were saying is that they've furloughed staff, even though they've received grants, they've received bailouts. They should have been using that money for staffing to provide better care for these patients. These patients are isolated. They're, by themselves in the room, and the only contact they're having is us at this point. And the staff could have been used better and more appropriately. And the PPE definitely has been a problem. I don't think it's just financial. I think that there was initially, at some point, a hard time getting access to But I think at the same time, like I know that our facility took a grant to be able to peroxide our masks. And the masks that we're getting, the elastics are breaking off. We're retying them during a shift.
Well, I agree with Beckett in that our hospital too, and being one of the hotspots, was given grant money, I believe, from the state to use. And I'm sure they are, but it's not being seen in the personal protective equipment. At the beginning of this, yes, the hospitals were scrambling, and it wasn't a financial reason as to not have enough. We run on a program called Lean, and hopefully what society is learning is that hospitals and medical care cannot run lean. So what hospitals would have as stockpiles was limited to what their immediate use was. N95 masks are wonderful. They're really only needed to be used consistently with our TB population, because surgical masks are what we used mainly for flu. So my guess is the hospitals didn't store a ton of them. Pandemic happens, they now need to go get them. And they tried, but it wasn't a financial reason they weren't getting them. The problem is as they were getting them, we can't be guaranteed we were getting them. So, they would talk at the beginning, talk about their little limited supply and give us direct numbers, because we had meetings. I'm also part of the union at my hospital. I sit as a co-chair. And so we would have meetings with them and say, how many N95 masks? And they would give us numbers. We have 300, we have 500, we were able to acquire another 1,000. As the pandemic got rolling, we would still ask. They ran out of just the small ones. So then we went to other smalls. You can't tell me in 3 months they haven't gotten some of those original smalls back. We no longer get them on the floors. You have to ask for them specifically. The manager will then grill you on why you need another one, mainly the supervisors, not so much the floor managers themselves, and berate you as to, that looks good enough for you to use. That's lateral violence, and it shouldn't be happening. Certainly not to the hospitals make their money because of nursing care. You're not admitted to the hospital because you need your doctor. You're admitted to the hospital because you need your nurse to do something that the doctor wants you to have or done to you. We need to have the protective equipment to go care for these patients.
So how do we get the help out there to make sure that they're providing you the protection you require, as opposed to worrying about how many they have left, for the next 6 months or whatever is their reasoning? So what can we do for you? How can we help?
I think it's more just a public knowledge. I'm not so sure the public themselves can go out and acquire these masks and make sure we have them, right? It's just being aware of when the healthcare workers are frustrated, when we're on edge wanting you all to wear your basic masks or just stay home to keep this pandemic down so that we can go home to our families and be safe. It's not a joke. We want, I guess that's the biggest thing for the public, can help us in knowing that this is a real thing and that we are put at danger, not only just at home, but also at work. Not intentionally always from our patients, but by the germs that are carried in the world. And that, we're looking to the community to help us in staying home and keeping their hygiene up, and letting the conglomerates of the world on the TV just to know that it's not true what they're saying. They make it look glorious for us as nurses and our equipment, and they've taken pictures of us, or we've allowed pictures to be taken of us in our full garb, but then they use it as a parade of heroes. We just want to be safe and take care of our patients. We don't really want to be used as their PR.
Sheila, this seems to be the same kind of thing you see with the healthcare violence. People aren't as aware of it. So what can we do to step up the pressure, I guess, on these folks to release this equipment and let the nurses and people who need it have it?
One of the things is we all have to talk about it. the public truly doesn't understand. They don't want to understand. They're afraid of it. They can't imagine having violence in the emergency room or the hospital if they knew what can happen with their loved ones there without the nurses around. It's something that, it's just like we couldn't believe that you could get hurt in church, but it happens. And it's been happening for a long time, and it gets covered up. We need to really speak about it, to document everything. As one nurse, she got kicked one time and she ended up dying a few days later because of a blood clot. That has to be documented. The nurses now have to document that they're being made to wear these masks that are chemicals. Nobody knows in 2 years, 5 years, what these chemicals are going to do to their lungs. That's like 9/11 with the firefighters. What happened to their lungs with what was going on with the atmosphere? This is terrible. The nurses have the knowledge, they have the skill, everything. I would want these 2 nurses taking care of my family, but I would want them to be safe because you never know what the family can give them. And they're young. They're just starting out. I don't know what more. Everybody knows, with the pandemic, everybody knows that they need the protective equipment. But it's like, who does anything? Nobody seems to do anything about it. So I don't know. I mean, God, the governor is good. He's so up to his eyeballs in just the pandemic alone. He did, I don't know if it was Mayor Walsh or the governor talking about what Stewart did.
Mayor Walsh.
Amy, can you talk about what Stewart did?
Mayor Walsh had gone on, and I don't know that he named Stewart specifically, but he had said that they had stockpiles of gowns. And he did say that if you have equipment, you are to give it to the nurses now, not stockpile it for your future date of something. And maybe that is something that the communities can do. Write a little letter, send a little note to their local hospitals, just hoping that they are one of the few, assuming maybe there's one somewhere, giving the equipment to their nurses the way it was intended.
Yeah,
That's a good point.
It is. That's a real good point. And some of these nurses, I was trying to look at your faces, and I've seen some of the nurses with the marks on their faces from wearing the masks for hours and hours.
I have bruising all here. It's all bruised, and you can't really touch it. It's very sore. And I have a bump on my nose here.
And the black and blues.
Mm-hmm.
We're getting black and blue eyes from it. Like, this is not, the yellowing is getting, that's a day old.
Yeah. I'm thinking an abscess is probably going to end up here. It hasn't happened yet, but man,
we're all breaking out and getting dry from it. It's
that
like
should never happen.
In reverse.
So these are the issues, Michael, that you don't know. The public doesn't know.
We need to make them know. We need to share this video with as many people as we can get shared so they start becoming aware of it and put pressure on these hospital administrators to release that protective equipment. Your life depends on it.
I agree. And I think maybe that is the best way, because from a government standpoint, we're not seeing any withholding, at least not that we're aware of. Mm-hmm. But it's the hospitals. And if they're allowed to reopen and they have to have 2 weeks of PPE on hand by the governor's rules to reopen any of their services, and I know my hospital is gearing up to let a couple of urgent electives or urgent endoscopies happen.
They've already started.
They must have to have gear. So where is that gear? And why can't I have that now? Why are we waiting?
That's so true.
They've already started doing surgeries at our hospital.
It's not preventing anybody from, contacting anything if it's sitting in a closet. It's got to be utilized to be effective. So.
Right.
Exactly.
but it allows them to meet the Department of Public Health's guidelines and standards so that they can reopen to start making money again.
That's right.
Because it's unfortunately, I work for a for-profit hospital, and the mantra is not patients over profit, unfortunately.
It's profits.
And it should be. It should always be about the patients.
Mm-hmm.
I agree with you, ladies. We've got to do more to help in this situation as the public. We can't just stand by and say, oh, that's too bad, and then it continues to happen. So we need to get more people to understand and be aware and do what they can to help. Share this video, call their hospital administrator and complain that the nurses aren't getting the protection they require. So
I think that would be a great idea.
Perfect.
well, if we can, let's go to you, Amy. Tell us the phone number to call at your hospital to, say, give the nurses what they need.
The direct phone number there is 508-941-7000.
Okay. And Beckett, what number can they call at your hospital?
Our main hospital number is 508-363-5000.
Okay. So you folks out there that are watching this, help these nurses out. They're God's angels here. They're doing work to help you as the public get better and recover from this pandemic and whatever other reason you're at the hospital. Why not, help the people that are helping you? They need that protection to be able to continue working and helping you. So, well, ladies, is there anything else we can help you with today or talk about?
There's a couple of other things I'd just like to mention, Michael and Amy and
Sure,
Beckett.
go ahead.
I talk about the abuse and the assaults. Well, now the nurses, when they have to take the bus or a train, they get assaulted on the train because they're in their scrubs. Even if they're brand new scrubs, or maybe not brand new, but new for the day. The nurses have been assaulted in supermarkets because they have scrubs on. And I mean, it just goes on and on. Nurses have been spit on because they knew she was a nurse or he was a nurse.
I don't understand that kind of thinking. What would make a person do that?
It's fear.
Well, I'm
It's
not
fear.
sure.
It's
But
fear.
this goes on. The other thing is that nurses have been having post-traumatic stress syndrome, and they're also having increased anxiety, and there has been suicides among the nurses. And this is something that we all need to to be mindful of, because this reminds me of the Vietnam vets that came back and we missed the boat with them. Too many of them saw too much and couldn't handle it. And I would hate to see our nurses, our healthcare workers, not just nurses, the respiratory therapists, the x-ray techs, ultrasound, CAT scanners, everybody that works in this pandemic, at least be supported and taken care of. If they can't do a mask, I don't know what's going to happen in the long run. But if you girls would like to say something else.
I think, unfortunately, that's going to be up to us. I was just actually talking to our crisis team, one of our social workers the other night, and we both agreed that we don't have enough mental health services right now just for the mental health population, never mind for this huge wave of healthcare providers that are going to come down the train. And it's, as you said, it's not only just the nurses, it's the docs, it's the medics, it's the EMTs. It's all of us that have been on the front line of this. Even the police and the fire. I mean, it's all of us that are on the front lines, maintaining and taking care of the public while they're sick. And, as Amy said, she's isolated from her family. I'm isolated from mine. I'm living in a college dorm again. This is 20 years, didn't picture being on a college dorm mattress again, but that's what we're doing to protect our families. So not only are we in a moment of just a pandemic that we couldn't have even fathomed how severe this is, but then we're now also isolated from the ones who support us and love us, and we can't hug our family. We can't, at the end of a bad day, when you have that bad code, you go home and you hug your loved ones. You see that kid that got hurt, you go home and you hug your kid, and you're grateful for that moment with your child and appreciate that they're healthy. And we can't do that right now.
Right.
So the coping mechanisms that we usually have in place are gone.
Yep.
So we've had to either learn new ones, and afterwards, and we're still in that mode. We're still, I don't know about you, Amy, but we're still in that mental mode of, if there's a trauma and you're on shift, you don't deal with that then.
No, you don't have time because you have another patient.
You put it off, and you go on to the next task. You go on to the next patient. You go on to the next problem, and you prioritize. So we're never, as typically as nurses and as mothers and as women, we don't tend to prioritize ourselves. So during this, we haven't been either. We're just putting off the baggage. As my father always says, you're just filling the bag. And right now, people's bags are pretty full, and they're going to start breaking. And we don't have time for that. I think at this point, Amy, we're just starting the second bag.
Exactly. I mean, my hospital's finally putting up tents today, preparing for another surge. And I was just having a conversation yesterday with my husband, and he's going, well, the country's opening up. When are you coming back?
Yeah, I can't
feel comfortable. I can't.
Yes. And that's, they've said that to me, well, when are you coming home? I'm like, well, I'm still taking care of these patients. It's not like there aren't these COVID patients still coming in, and I'm not still being exposed, because how great is that mask seal? How great is that mask that we have on?
If I was going with new equipment, I might feel a little better at this point
about
with
going
my
home.
own personal hygiene, but I don't.
So it's just the risk of exposure and exposing our loved ones. And what we were talking about with the crisis team is that, we're going to have to set up groups, like literal support groups, where, that'll be beneficial to have those peer support and peer relations type of situations going on. But at the same time, it takes you at baseline 3 to 4 months to get in with a psychologist or a psychiatrist. And 3 to 4 months from now, we're going to have people breaking. Nobody's thinking about making an appointment now. And never mind that was just baseline.
Right.
Never mind with the surge that's coming of mental health issues, the PTSD, the anxiety, the depression, the sleep deprivation that's going to happen just from the repeat and the replays of everything that went on.
I'm getting anxiety just hearing all this. This is like, you don't realize it until you hear it from, right from the people dealing with it.
You're right, Michael. That's why it's so important, and I'm so happy that you invited us to come to Boston, making a difference. This is so, and this is only 2 nurses. There are so many out there, and they could tell different stories.
I bet.
It's sad.
Well, I hope we can help some with this and get this program out there and share it with as many people, as we can, and, make more people aware of this problem. It's a multi-level problem. It's not just one thing. From what I'm hearing here, there's a lot of issues.
There is a lot of issues. And these folks are the ones that will take care of your mom, your dad, your sister, your brother, your cousin, your child. And you want them to be safe, and you want your family to be safe.
Absolutely.
And it's not happening.
And it's a right. It's not a privilege. It's a right. They should have that safety and protection required to do this public-facing job that's in a time that, none of us know what to expect next. We don't know. It's just happening as it happens. But this kind of stuff falls through the cracks. Nobody pays attention to it, but they need to, because you're the people that are taking care of us. If you're not there because you're sick and died, what are we going to do? So we as a public need to help as much as we can too, because it's all boiling down to public safety, and everyone has a responsibility there, so.
I think you hit the nail on the head, Mike. It is public safety. Because if I'm coming home having not had the proper equipment in the face of the virus, I am infecting or affecting the public. And there's nothing I can do about it.
It's a scary thing, but we have to start somewhere on the road to trying to make it better and trying to help. So, when we get this video out, let's all share it and ask friends to share it and get people to listen, and to pick up that phone and call and say, give them that equipment they need to protect us, so it's important. Now, Sheila, anything else that we can cover today for you?
No, I think what we discussed already is plenty. I mean, it may be a different time, and maybe the girls can update you, and
sure.
That would be awesome. Get it out there and let them know. Oh,
absolutely, ladies. Anything else you want to add before we go?
No, just thank you to you and thank you to Sheila.
Yeah, quite welcome.
Bringing our voices public. We appreciate it.
Okay, well, that's it for this edition of Boston Making a Difference. And these nurses, these God's angels sent to us, are doing their job, doing their part to make a difference. Let's try to do that for them. Let's go and make a difference for them. And pick up that phone, write your legislator, help these folks on the front lines deal with a worldwide problem that's right at our doorstep. And if we fall behind right here now, what are we going to do in 6 months from now if it's still going on? So let's help them right now. Go out and make a difference yourself and make the phone call. Ladies, thank you so much. I appreciate it. And take care. Have a great weekend. And thank you again for doing the wonderful and dangerous work that you're doing for us. I truly appreciate it from the bottom of my heart. I appreciate your work out there. Thank you.
Thank you, Michael.
Thank you.
Okay. Take care.
All right. Bye-bye.